I'm Evan Unger. I'm a professor of radiology and biomedical engineering at the University of Arizona in Tucson, and I'm also director of the body imaging section. Body imaging includes CAT scans, magnetic resonance, and diagnostic ultrasound. And so I practice all three kinds of imaging. And ultrasound's very important because of the absence of ionizing radiation, because it can be done at the bedside, it can be done up in the ICU on critically ill patients, and there's a lot of advantages compared to the other modalities. And when I think of examining patients, I think if it's possible, we should choose ultrasound first because of the cost. I've also done a lot of invasive procedures, biopsies and ablations and things, and when you're right there with the patient, next to the patient while you're doing the procedure, I notice that it's more comfortable for the patients, it's just better for them. Now, ultrasound contrast affords us a number of advantages. Every day we see many cases on ultrasound of indeterminate renal masses, kidney lesions, spots in the liver. So what are these things? Well, ultrasound contrast allows us to determine what we're dealing with and avoid doing another examination, expense, ionizing radiation, and very common we'll see a kidney lesion in a patient who has renal insufficiency. And so then we have to refer them for a CAT scan with X-ray contrast, or for an MR scan with gadolinium contrast. And in both of those cases, it's well known that there's potential damage to the kidneys from those contrast agents. The ultrasound contrast does not have any damage to the kidneys. A recent thing that we found very useful is transplant patients. We have a very active liver transplant program, and it's often very difficult to determine if the hepatic artery is patent after transplantation, the peri-transplant period. It's critically important to determine that because the organ will die if the artery is occluded. And so we might take them for angiography, which is invasive, and many times these patients have renal compromise. So we can go to the bedside in the ICU, administer a simple dose of intravenous contrast. In my experience, we've been able to tell unequivocally whether or not the hepatic artery is patent. So I think there are many, many potential applications for ultrasound contrast to improve medical care for our patients.
Great. Would you to comment on the radiologist's ability to use ultrasound contrast in the United States compared to overseas?
Yes.
And where you'd like to see things go?
Well, I'd say it's severely limited in this country. A radiologist can prescribe ultrasound contrast if he or she feels it's indicated, but may not get reimbursed. And it's not promoted in the radiology literature in this country because of the absence of reimbursement. So ultrasound contrast is not used very much in radiology, which is unfortunate because of the advantages that I talked about.
What agent do you use for radiology right now?
Well, on our formulary, we have Definity.
Okay.
And
so you're using the cardiac?
Yeah, we're using the cardiac imaging agent, and in the cases where I use it, we get informed consent from the patient, and I don't believe we've been getting reimbursed. We've been using it though because we think it's helpful to the patient.
And would you like to comment on the extent to which ultrasound contrast is approved in the United States as opposed to overseas, and how the use of contrast follows that, you know, where this could be going?
Well, in Canada, Europe, and Japan, ultrasound contrast are approved for radiology indications. So it's used commonly in the rest of the world, but in our country there are only approvals for the cardiac indications. So at my own institution, for example, the cardiologists commonly use DEFINITY. It's used every day. In my institution, where I'm an expert, it's only occasionally that I use it because we don't have the reimbursement. But in, for example, a patient with hepatic arteries or in the transplant period, someone who has severe renal compromise and has an indeterminate kidney lesion, that kind of a case. But very rarely it's because of the absence of approved indication.
If you could design the perfect world and reimbursement and approval was not an issue, how would you want to use ultrasound contrast in your radiology practice?
Well,
or not only you, but let's say radiologists in general. How would ultrasound contrast be used?
well, I would first perform the examination without contrast, and then if I had a question, I would not hesitate to use ultrasound contrast. And this would be in routine cases. For example, the patient who comes has a kidney scan, we see something that might be a cyst or it might be a solid neoplasm. But then in patients such as the transplants I mentioned, it would just be routine.
And can you tell us some of the specific examples of how it might be used in different areas of the body?
Well, you know, we don't have quite the experience in this country, but if we look at CAT scanning, for example, it's absolutely routine to give X-ray contrast media for your average patient. Now, there's some kinds of examinations, for example, looking for kidney stones, where we don't give it, but I would guess that 90% of the body imaging scans, somewhere between 80–90%, are performed with contrast at my institution. And I think as experience grows, we would use contrast more and more, and we would be able to avoid using more expensive and potentially hazardous techniques such as CT scanning, for example.
Because of the radiation?
Yeah, because of the radiation, and you know, I think most radiologists would believe that a CT scan is more sensitive for looking for liver metastases. But I think that with contrast, an ultrasound scan of the liver is going to be, you know, very comparable to a CT with contrast. And so I think that we just need more experience to be able to determine, you know, are we going to use it in everyone, most everyone, or in select cases. But it's a shame that we don't have it approved in our country.
Can you think of any specific patients where it really made a significant difference in the management?
Well, in a recent liver transplant patient, it meant the difference between the patient going down for an angiogram versus just being able to follow the patient. And it was very important in that patient because the kidneys were failing, and the patient was able to stay off of dialysis and recovered. So that's just one example.
Can you think of any others involving other areas of the body that?
Well, kidneys. You know, such an important thing. It's not a day goes by that we don't see an indeterminate kidney lesion. We can't tell what it is, and so then get a CAT scan or an MRI scan.
And if you used contrast ultrasound, the others could be avoided?
Yeah, we wouldn't need to do them. I think it would be the rare situation where we would need to do a CT scan or an MR scan.
Is there anything else you think should be said about contrast?
Well, I think there's been a lot of concern about the safety of these microbubble agents, and if we look at CAT scanning, where we give X-ray contrast media to as I said, most patients. I believe the safety index, the safety factor, is much higher for the ultrasound contrast than it is for the CT scan. And so we're hung up on the bubbles, hung up on the safety, yet we're doing something that is more dangerous in terms of the contrast routinely. If the dose of X-ray contrast is 100 cc's, and if you give someone 10 times that amount, you're going to put them into pulmonary edema. You're going to cause all kinds of problems. Even with that dose of 100 cc's, we have commonly anaphylactic reactions or allergic reactions. I've seen myself very severe reactions from X-ray contrast media, but the safety factor is much higher for the microbubble agents, meaning you could give a higher dose safely to the patients and have this greater safety factor. And then, thinking of CAT scanning, this has the ionizing radiation. And then MRI scanning, nephrogenic sclerosing fibrosis has been discovered to be a severe problem.
Could you explain in layman's terms what that is?
Well, the gadolinium metal was found to leak out of the contrast agents and then cause this potentially deadly disease very similar to lupus, systemic lupus. It's not the same, but the presentation is quite similar. Now, it's understood that only certain kinds of MRI contrast agents cause that, but still they can be damaging to the kidneys, whether or not that occurs. And you're subjecting someone to an expensive examination. It's not uncommon for patients to be claustrophobic. Then if they need the MRI scan, they need to have sedation for the claustrophobia. And we have a lot of patients with pacemakers or spinal stimulators or devices, and they can't have an MRI scan. So it's very unfortunate that we don't have this approved, because it would save money and be better for the patients and improve the outcomes to have the approval.
You don't have any pediatric?
We have a very large pediatric practice, and I'm not a pediatric radiologist, but I'm familiar with the issues. And we also have a pediatric transplant program, and it's very important in them because the vessels are very small. It's difficult to tell if the vessels are patent or not in the post-transplantation period, even more important than the adults. And when you're dealing with these tiny vessels in these children, contrast can really improve detection and characterization. Very important.
Contrast ultrasound.
Pardon? With contrast ultrasound, yes.
Could you say that again, but say contrast ultrasound instead of just contrast?
Contrast ultrasound is very important in the pediatric population. It's very difficult to see the tiny blood vessels, for example, in the liver transplant patients, and ultrasound contrast makes a very big difference.
Is there any concern you have about the cumulative impact of radiation in various imaging technologies, and would that be another benefit for young people?
Well, it's not uncommon to see young patients with chronic diseases, for example, inflammatory bowel disease or lymphoma, other diseases, who have many, potentially several CT scans a year for much of their lives. And we understand that radiation damage is cumulative, and so it's very concerning. And getting back to what I said earlier, if we can do ultrasound and get the appropriate diagnostic information, that's where we should go first. And so ultrasound contrast extends the utility of diagnostic ultrasound and allows us to use this safer technology compared to CT scanning.